A new study this morning could mean hope for people with migraines. About 36 million Americans suffer from the chronic headaches. They can strike up to 15 times a month, lasting between 4 and 72 hours. Dr. James Galvin is a professor of neurology and psychiatry at NYU Langone Medical Center. Welcome.
Thank you, Charlie.
So how does this work in terms of an electrical shock? What does it do and why does it bring relief?
Well, it's a thin wire, and it's placed on the nerve, and it has a little power pack. And so what it does is it gives a little electrical pulse, which probably decreases the activity of the nerve, so less input, so less pain.
How did they get the little wire into the brain?
It's surgically inserted along the back of the head or over the eyebrow, and it's attached to a power pack which is implanted under the skin like a pacemaker.
Do you think this is a breakthrough?
It is a breakthrough. So these types of devices have been used for other diseases, such as depression or seizures, but now are being used to treat headaches. And in the study that was done, there was a dramatic response by the people who had the implant put in.
So this isn't the first time this technology has been used. How else is it showing signs of success?
So it's been used for a longer period of time for people who have epilepsy that's not responsive to medications, and depression which has not been responsive to medication, as well as some pain syndromes, so following trauma or for diabetics. More recently now it's being tried for migraines with some success.
Okay, and depression, what does it do for depression?
For depression and for, it seems to stimulate actually back into the brain and increase the release of neurotransmitters. So it seems to reduce the mood effect.
So millions of Americans suffer from migraines and really bad headaches. If they're seeing this, how accessible is this technology?
Well, it's not for everybody. People should take their medicines first. What we're really talking about here are people with chronic migraines, those people who have headaches more than 15 times a month for a long duration of time and are not responsive to their medications.
Looking out, go ahead.
I was going to say, if you have a migraine sufferer and you want to ask your doctor about this, what should you ask for? What's it called that they can ask for and try and get this technology?
It's called the Peripheral Nerve Stimulator.
Right.
Okay, when you do blue sky things like this and you begin thinking about the possibilities for the future, what are they?
Well, the possibility for the future for those people who are not responsive to medicines, we can potentially reduce the severity or intensity of migraines by about 70%. Reduce the frequency of migraines perhaps by 50%. And in this study, over 90% of people found it to be effective.
And that's why it's so promising.
Yes.
Yeah. Dr. James Galvin, thank you so much.
Thank you.